Hi, I want to show you a great stretch that I know can help a lot of your lower back issues, sciatica, burning, tingling, numbness, and those pinched nerves, those chronic conditions. I know you've probably been on medication, maybe been told that you needed more invasive procedures like surgery or epidurals, but this particular stretch, this is something you need to do every day, maybe twice a day, morning and night. It's a very simple stretch, and it's designed to release that tight muscle, the hamstrings, that's attaching behind the knee and attaching to the pelvis. The problem with tight hamstrings is that whenever we bend forward, the purpose and function of the hamstring is to be utilized first, that hamstring should stretch to take stress off the lower back. So as we lean forward, and if the hamstrings are tight, they're going to lock out, putting all the stress in the lower back, making the back problem worse. When you loosen up those hamstrings, it frees up the lower back, gives it a lot more mobility, and you're going to have a lot less pain. On this spine here, you can see that this is the back part of the pelvis. You have the obturator foramen, and down below the obturator foramen, you have what they call the ischial tuberosity. This is where the insertion when the hamstrings attaches, and this actually attaches to the knee joint. So when the pelvic is actually going forward, okay, in this position here, you get a lot of movement in the hamstrings. But when the hamstrings are locked out, all the stress goes back to the lower back area. So this stretch I'm about to show you is something, again, you need to do regularly. Now here's the important thing about the stretch. You're always going to stretch both legs. You can do this on a couch, a bed, on the floor, on a mat, at the gym, wherever you like. It's all good. But when you stretch, the first thing I want to tell you is never bob, never jolt your body. I like you to breathe normally, keep the knee locked out, and lean forward into the leg, into the thigh, into the knee area, and you'll feel the back of the hamstring start to stretch. Now you may be saying, ow, it hurts. That's okay. Don't go any farther. You just hold it there for 20-25 seconds, and then you'll eventually release it. The next important thing is I want you to get the full stretch of this hamstring, because there are several muscles behind the thigh that actually work along with the hamstrings. But what I like you to do is take your toe and externally rotate it outwards like this. And now I want you to lean forward, and now you're going to feel more burning on the inside of the back of the thigh, called the medial part. Okay, those muscles. Hold it 25-30 seconds. Now let it burn, don't bob, get to the point to where it hurts, don't over push it, and just breathe into it nice and gentle. You're going to come up, you're going to go ahead and take the foot, and you're going to immediately rotate it towards the inner side, towards your body, and then you're going to go forward, and you're going to feel the outside of those back of the thighs start to stretch. Understand, everything is biomechanics, neuromuscular. We have origin insertions of the muscle, and each muscle is designed to work in a certain fashion, and so by changing the action, the mechanics of the body, we will then change the action of the muscle that we're going to work. And you'll feel that the outside of that muscle is going to work. So generally, wherever you bring your toe, it's going to be the opposite side of that muscle you're going to work. So straight ahead, you're going to work behind. When you externally rotate it to the outside, you'll work the medial or inside. And when you bring it inwards, the toe, you'll work the outside of the back of the thigh. I'd like you to do this stretch once, twice a day. Keep allowing those muscles to expand and become more lengthened. As it becomes more lengthened, it's going to give the lower back more room to breathe, and it has to put less stress on the lower back, allowing it to heal quicker and allowing you to feel much better. Make it a great day. I'm Dr. Mandell.